everyone, I'm Dr. Christina Huang, a board-certified dermatologist, and today I am teaming up with the Roche-Posay to answer your most frequently asked skincare questions. Whether it's about acne, sunscreen, hyperpigmentation, I'll be breaking down the science and giving you practical tips that you can actually use every single day. So if you've ever wondered what really works and why, you're in the right place. Let's get right into it. Question number 1, what is the best thing to do when I get a pimple? As tempting as it is, do not pop it. Popping pimples can lead to scarring, worsening of inflammation, or pushing the bacteria deeper into your skin. I usually recommend by starting with over-the-counter treatments like Effaclar Duo Plus M. This can help clear out blackheads, whiteheads, and decrease pimples and inflammation. Also, don't be scared to see a board-certified dermatologist because we have a lot of prescription-grade creams and even pills to help with acne treatment. Question number 2, how long should a new skincare product take to see results? As a general rule of thumb, I always tell my patients to wait at least 3 to 4 months of using the product consistently before making a call about whether or not it's working. Remember that skin cell turnover is gradual, so these treatments do take time. How does cancer treatments like chemotherapy and radiation contribute to the skin and the development of dark spots and hyperpigmentation? So chemotherapy and radiation not only target the bad cancerous cells, they also like to target rapidly proliferating cells like melanocytes in the skin. Melanocytes are the cells in your skin that produce pigment. As a result, when the skin is trying to repair itself, the melanocytes can either overproduce or underproduce pigment, leading to patchy or discolored skin. These cancer treatments can also damage the oil glands in the skin, making the skin very dull or dry. That's why moisturization is also a key component. A common question I frequently get asked is how do you treat or lighten dark spots or pigmentation? The answer is usually twofold. We want to lighten the ones that are already there, but also prevent new dark spots from forming. That's why it's crucial to use brightening agents in combination with SPF. What is the difference between mineral and chemical sunscreen? So mineral sunscreens are otherwise known as physical sunscreens, and they contain ingredients such as zinc oxide or titanium dioxide. They sit on the surface of your skin, and like a shield, it physically blocks UV or reflects UV away from your skin. Chemical sunscreens, on the other hand, work by absorbing all the UV rays and converting them into heat before releasing them off of your skin. They both offer excellent protection, and as a dermatologist, I think it really comes down to the consistency and the texture and the feel of the sunscreen and what you personally prefer. Just remember to make sure that it's SPF 30 or above and protects against both UVA and UVB. The good news is La Roche-Posay have great options in both categories with affordable price points. Does eating or drinking collagen help with skin collagen and elasticity? Current scientific evidence suggests that oral supplementation of collagen, either through foods, pills, or drinks, can have some positive effects on skin health. Collagen ingested by mouth is broken down into smaller proteins in the gut and then absorbed into the bloodstream to stimulate cells in the skin that stimulate more collagen production. We definitely need more long-term, larger-scale studies on this, but what we do know is that collagen supplementation is not a substitute for protective skin behaviors. When or at what age should I start a retinol? Retinol is actually a common acne treatment, so sometimes it's started as early as in the teens. If you want to use it for its anti-aging effects, I usually recommend to start it in the early to mid-20s to prevent pigmentation, skin texture changes, and fine lines and wrinkles from forming. Remember though to start slowly, like every second or third night, and slowly work your way up to every single night as you can tolerate it, because these can cause dryness and irritation. Whether you opt for an over-the-counter one like La Roche-Posay's Retinol B3 serum or prescription-grade retinoid, I always recommend the sandwich method. This is when you use a moisturizer before and after using the retinoid to help with that dryness and flaking. Personally, I love the Cicaplast or Toleraine lines to pair with my retinoid so I can have glowing skin without looking like a scaly fish. Everyone has different genetics and skin types, so how do you pick the right products for your skin type? Honestly, I can go on about this for hours, but let's simplify things with my favorite products from La Roche-Posay. Oily or acne-prone skin, Effaclar line. Dry or sensitive skin, Toleraine line. If hyperpigmentation is your jam, then Mila B3, vitamin C, and their SPFs. What is microbiome in skincare? The skin has a microbiome. meaning it has a natural amount of bacteria and fungi living on it to protect it. Another reason why I commonly recommend La Roche-Posay to my patients is because they have products and formulations to help support microbiome balance and skin barrier health. What are safe acne treatments in pregnancy? Topical and oral retinoids are major no-nos. However, ingredients like benzoyl peroxide, topical antibiotics, azelaic acid, niacinamide, and gentle cleansers and moisturizers are great for acne in pregnancy. That's all we have time for today. I hope you learned a thing or two. Please leave any of your burning questions in the comments below and follow and subscribe for more content.